At its most fundamental level, ethics is the system of moral principles that governs a person's behavior or the conducting of an activity. In medicine and pharmaceutics, ethics transcends professionalism. It becomes a sacred and non-negotiable covenant. The relationship is defined by an imbalance. The patient is vulnerable, while the professional holds the power to heal. This asymmetry creates an absolute moral duty to act with unimpeachable integrity. Everything we have discussed, strategy, skills, targets, and leadership, must be subservient to the foundation of ethics. Ethics is the unwritten covenant between our industry and humanity. A violation of this trust is not a business misstep, it is a moral failure. This chapter explores our profound ethical obligations down to the tiniest moments of daily work. The products we represent are instruments of healing and carry potential for harm if misused. The patient is a person, not a data point. Every decision must pass a moral, not just a commercial lens. The well-being of the patient must, without exception, supersede all other objectives.
My target is high, but this doctor sees frail elderly patients. I must proactively and clearly discuss relevant side effects.
A minor operational detail becomes a profound ethical act. Proper sample storage preserves integrity. Ethics lives in the smallest details. We are stewards of scientific data, obliged to present balanced, truthful information. Truth is tested in the microns of a presentation, like the y-axis of a graph.
Doctor, that is a critical question. Allow me to get the exact information from our medical department and share it with you.
Humility builds credibility. Integrity is the sum of thousands of small, unseen choices. That single act of accurate data entry can have far-reaching consequences. Integrity is in how you treat every human being, receptionists included. Fair and ethical business practices, not undue pressure. A patient alone at home is about to take a medicine, placing trust in an invisible chain. Our mission is to be worthy of that silent, absolute trust. The drugstore manager or pharmacist is the final guardian of patient safety. Their ethics are tangible, in every strip dispensed and every counsel given. Fidelity to the physician's prescription is the primary ethical duty. Resist unauthorized brand substitution, despite commercial temptation. Professional courage is calling to clarify rather than assuming. A dosage double-check can prevent harm. Responsibility extends beyond the counter. Ensure safe, effective use.
Please take this tablet with food to avoid stomach upset.
Patience and empathy are part of care.
With your consent, I can consult your doctor about an appropriate, more affordable alternative.
Ensure authenticity and proper storage for every product on the shelf. Unwavering refusal of grey market stock is a frontline defense. Meticulous cold chain monitoring preserves potency of vaccines and insulins. Routine checks prevent near-expiry dispensing. Community trust is earned through small, consistent ethical actions. Integrity is also the ultimate business-sustaining strategy. Fidelity over margins.
This syrup may cause mild drowsiness. That is normal.
Quiet routines protect patients. Clear segregation prevents misuse. At the counter's edge, ethics becomes action. Trust is priceless and entirely ethical in origin. The drugstore assistant is the most frequent point of interaction with the public, perceived as knowledgeable, thus a significant ethical responsibility. Protect private health information with absolute discretion. Do not speak loudly about a customer's medication near others. Never gossip or share stories about a customer. Maintain the same respectful demeanor for every condition. Guide, do not diagnose.
I am not a doctor and cannot diagnose. I can show general pain relief options, and you must see a physician for diagnosis. I cannot dispense antibiotics without a valid prescription.
Resisting the quick fix helps combat antimicrobial resistance. Every transaction is a test of integrity. Provide the correct bill and exact change. Do not push a more expensive product when an equally effective, affordable option exists. Be transparent, no coercion. In the customer's eyes, the assistant is the pharmacy. Small ethical acts accumulate into trust. Confidentiality and honesty protect dignity and safety. Ethics at the counter sustains the community's faith in healthcare access. The pharmaceutical sales manager is the primary ethical role model. A team's compass points where the manager's does. Ethical leadership is demonstrated, not declared. Show compliant, on-label conversations, even under pressure.
We fell short, and here is my plan to fix it.
Never ask anyone to do what you would not do yourself. Use power with fairness and impartiality. Allocate territories and resources via objective, data-driven processes. Ensure equitable distribution of samples and budgets. Conduct objective, bias-free appraisals. Manage pressure without imposing impossible targets.
This target is challenging, yet achievable through honest work.
Be a shield against unrealistic pressures. Hold up the highest standard of conduct. Reinforce pharmacovigilance and accuracy. Culture compounds through daily choices. Fairness builds trust and mutual respect. Ethical management sustains performance. Ambition guided by ethics. The manager sets both the tone and the trajectory. To the healthcare community, you are the brand, an ambassador of ethical commitment. Adherence is fundamental, not optional. Your work directly impacts patient health and well-being.
I cannot promote off-label use.
Provide in-date samples, stored correctly, to benefit a patient. Follow company policy. Build on trust, scientific credibility, and respect for time. Keep calls concise and within allotted time. Provide fair, balanced information based on approved data.
I will find the exact answer from our medical department.
Never offer an improper inducement or gift. Win on clinical merit. Be a steward of assets and reputation. Be honest and accurate in administrative duties. Compete fiercely but fairly. Win business on the merits of your offerings. Your professional reputation is your most valuable asset. Commit to continuous learning and dignity in conduct. The code is a source of long-term professional pride. It is the foundation for a sustainable and respected career. The Uniform Code for Pharmaceutical Marketing Practices is the rulebook for ethical conduct, issued by the Department of Pharmaceuticals to align promotion with patient interests. Voluntary, self-regulatory, but treated with the seriousness of law by reputable companies. It protects medical integrity and patient safety. No gift, pecuniary advantage, or benefit in kind to healthcare professionals or families. Compliant, modest brand reminders. Violation, cash, renovations, holidays, expensive gadgets. All promotion must be accurate, balanced, verifiable, and not misleading. Use approved claims. Disclose limitations. Never make off-label claims. Samples are limited for clinical evaluation and marked not for sale. Dumping excessive samples, especially old brands, is a disguised inducement. CME sponsorship must be genuinely educational and modest. No resort junkets with token science. Use only company-approved materials. Report safety information as per protocol. The UCPMP is not a hurdle to be overcome. It is a guardrail to keep us safe. It protects the patient, the doctor's integrity, and our reputation. The MR who sees compliance as a partner has a long, prosperous career. Those who see it as a barrier eventually, inevitably crash. From lab to sales call to the patient's home, ethics binds every link in the chain. When ethics leads and compliance guards, we earn the trust that changes lives.